Yeah, so the primary learnings for that session were basically just to highlight that the use of CAR T cell therapy is feasible in patients who have T cell driven malignancies. It is a bit more complex compared to treating B cell malignancies because we're using T cells to treat T cell driven diseases that often express the same antigens that we're targeting. But our group has been able to develop methods where we're able to overcome one of the primary issues, which is fratricide, and able to see signals of efficacy. In addition to our CD5 study, I also discussed the use of CD7 CAR T cells. At this time, the data that is primarily available has been based on work presented from several groups out of China, and primarily in patients with a T-ALL or T-lymphoblastic lymphoma. But it's very, very encouraging with response rates of 80 to 90% in these very refractory, heavily pretreated patients. And we at Baylor have just actually activated our own CD7 CAR T study that allows both patients with T-cell lymphoma and T-cell leukemia on this trial. And so we've just started enrolling and treated patients on that. So we're very excited and hope to present data from that soon. And then lastly, I discussed some of the early data in using CD30 CAR T cells to treat CD30 positive peripheral T cell lymphomas, which again, numbers are small, but definitely encouraging, specifically in patients that have been very heavily pretreated. And with data out of our center and also out of UNC, there's been about a 33% complete response rate, 22% PR. So the overall response rate is around 55%, which is encouraging. And for all three of these targets, so far the safety profile has been very favorable with no significant or severe cytokine release syndrome or neurotoxicity observed.